Hello, my name is Amir Rashid. So in this video, I'm going to be talking to you about the nursing assisted care for patients with chest tubes. Now first we need to know what are chest tubes. Now chest tubes are sterile plastic tubings that are inserted through the skin of the chest into the spaces between the covering of the lungs and the membrane lining the chest. Chest tubes are used to treat an air leak or to drain out fluids from the surrounding area of the lungs. Now generally the chest tube is attached to a drain to help easily pump out the fluids. Now I'm going to show you on how to care for a chest tube. Now first of all, you must need to know that as I said before, a chest tube is like a surgical drain, meaning that it can be a pathway for passengers to enter through, which means that we have to always be sterile ourselves by wearing maybe sterile gloves, wash our hands, and if needed, if there's a chance of it for it to spray out, then wear a PPE gown to protect yourself. So first, we must introduce ourselves to the patient and say what we are going to do to him today. So, hello sir, my name is Amir. So today I'm just going to be checking on your chest tube. Will that be okay? Oh, okay, thank you. So now that we got the consent of the patient, we can begin to check his chest tube. So sir, please, I'm just going to go over this. And I'm going to lift up your arm, okay? Okay, there you are. This is the side of the chest tube, and it looks okay. Try observe if there are any sort of contamination with any discharge, bodily discharge, such as maybe blood, pus, or any others, and see if the tubing has come loose or if it needs some repositioning. If not, then you can leave it be or maybe change the dressing. Now this dressing is just used to secure the chest tube into place as to not move it around. Okay, so as you can see here, it's all okay. I'm done checking the chest tube insertion area. We can now check on the tubing itself. Now you have to make sure to keep the kinks free from any kinks, the tubing free from any kinks or occlusions. For instance, maybe the tube was beneath the patient or it got pinched between the side rails of the bed. Now we check here and see that the tubing has become kinked a little bit, so now we just have to straighten it out. Ensure that the fluid is able to flow freely into the pump. Okay, that's good. So now the last thing we need to check is we have to check the pump itself. Now the pump is supposed to sit below the level of the patient so that it could pump efficiently and get into the coordinator. So now here, example of the pump I have. You have to check. For this we can check the amount of fluid that has been collected by the pump and see if it's either an estimated amount that we can consider as good, or if it has no fluid or overfilled with fluid. So here we can see that fluid is okay. The amount is a reasonable amount for the time of placement of this chest tube. So now we can put it back down here. Now of course remember to dispose of your gloves first before closing back the patient. Okay sir, so I've done all my necessary checking. Now I'm just going to close you back, okay sir? Here. Okay. And okay. During my checking there, did you feel any sort of pain or discomfort, sir? No? Alright, yeah, that's good. So now that's done, we can document on what we did, write down what we did and write down the amount that has been recorded on the container of the drain. Okay, and that's it, sir. So that's it. Thank you.